Hi, my name is Heather Hughes and I own Optimum Health and Wellness, and we are located in the Land O'Lakes, Florida. We are an outpatient private practice mental health focusing on functional and integrative psychiatry. Many people wonder if they have ADHD, if again they're struggling in some capacity, work, school, home. They're falling behind on things that were typically fairly easy for them to accomplish. If something changes within their routine, like a job role or school, the demands are a little bit higher, they struggle a little bit more because again, a lot of people with ADHD have workarounds to just get the job done. They've learned how to deal with it a lot of times, especially if it's diagnosed later on in life. And at some point that becomes inefficient and they start to struggle. Someone should get evaluated for ADHD if they feel like it's impairing their quality of life or their ability to perform their day-to-day routines. I see people on a wide range, right? People who maybe they need to take a pre-exam for school, but they put it off and put it off and put it off and put it off, and they just can't sit still, they can't concentrate to do it. But that's in multiple areas of their life. Other people do really well in school, let's say, and then they change grades or take a different course and suddenly they're unable to complete all of their work, and they're really trying, they're really spending a lot of time and they're putting in the work. They have a tutor maybe, it's just not clicking the same way where it was effortless before. In some cases, people have always kind of struggled. They just don't know that's a thing, that they made D's and C's and they got through school and made it, and it is kind of, they've normalized it essentially. And that's not normal. So I would say that's also a big red flag to get checked out. So ADHD is diagnosed, for clinicians we use like DSM-5, we use a lot of different screenings to evaluate the magnitude of the symptoms and how they impact your day-to-day life and quality of life. So it just comes from a thorough evaluation, completing associated screening forms, and ensuring that it aligns with the correct diagnosis again. We offer a lot of treatment options for ADHD, some medication management, an array of different types of medication that you can take. Again, that's individualized and it comes from a personalized treatment plan. Also lab optimization, supplementation. We offer lens neurofeedback that can help unsuppress parts of the brain that are hyper or hyposuppressed. Behavioral modifications and kind of working through that, because one of the biggest things that I see is people really struggle if they don't keep a schedule and keep a routine and minimize their distractions throughout the day. A lot of really high functioning people, right? So we just need to pull back on the way that you approach your day, keep the same schedule, and try to help you optimize your performance. I think there's a huge misconception right now with attention and focus, because we all are doing 14 things at once with our phones and our tablets, and that doesn't necessarily qualify someone to have ADHD. You just need to kind of minimize and structure, but you would need to have symptoms, in elementary school or maybe even middle school, carrying over into adulthood. I do think that the demands of us are becoming a little bit greater, so the symptoms, maybe we're able to, what I call like a workaround, you're able to work around them for a while, and now there's so many things that we have to do. When I became a nurse, there was just paper documentation, and now there's electronic documentation, and then there's like AI, and you can be doing 5 things at one time, or I'm going to have like 2 or 3 tabs every time I have a patient, for example, whether I'm sending meds or verifying their medical records or looking at lab work. And that can create a little bit of chaos in your brain. So when people change their workarounds or their routines, they can struggle a lot. They're failing school, they're falling behind in classes for kids, or adults are not able to keep up with the demands of their job. And it's so much more than, I just can't focus, I'm distracted, I lost my keys, or I've been scrolling on my phone and now I can't concentrate, because I think that's kind of normal once you get that. So there's a lot of different variables that go into it, And of course, ruling out other diagnoses are important, and a lot of times they can overlap, like anxiety, PTSD, OCD even. So I think it's just getting a thorough evaluation and making sure that you're treating what is really going on. Thank you so much for watching. If you have any questions or would like to inquire, you can reach us via our website at optimumhealthandwellness.org or our phone number 813-856-1515.